Welcome to Scrub In, a podcast where purpose meets care. We are more than just a podcast. We are real stories of hope, expert health advice, and inspiring conversations with the people behind the scrubs.
This podcast will leave you informed, inspired, and reminded of the purpose that connects us all. It's the voice of humanity in healthcare, uplifting, honest, and full of heart.
Featuring hosts Dr. Kendall Barton, Keisha Morris, and Alice Rausch. You can listen and subscribe on Apple Podcasts, Spotify, Google Play, and YouTube. Or visit bayhealth.org/scrubin to learn more. Now, let's scrub in. Here's our next episode.
Thanks for joining us for this latest edition of Scrub In. I'm Alice Rausch, joined by Keisha Morris. We're so happy to have our returning listeners join us, as well as our new listeners, as we're continuing to grow this listening audience here for Scrub In.
Absolutely. Always great to have returning and new listeners. So can't wait to get this show on the road. So as you know, we always start with a quote. And so our quote today is, "A man is as old as his arteries." And that's by Thomas Sydenham. Isn't that true?
I was going to say that's where the term young at heart comes into play.
I guess so. That would make sense.
Today, we're talking to Bayhealth Chief of Cardiology at Bayhealth Heart and Vascular Institute, Dr. Aditya Sharma. Thanks so much for joining us today.
Thank you for having me. As an avid listener for my medical knowledge, it's an honor and pleasure to be here. So I appreciate it.
That's awesome. It's glad to know you're an avid listener. So that does our heart well.
So tell us a little about yourself before we get started.
So I'm a practicing interventional cardiologist. I also have a background in business. I've always been interested not only in the clinical aspect of medicine, but also in the administrative aspects, program development, strategic planning, so on and so forth. I hail from central Pennsylvania, a population very similar to what we have here in Delaware, with similar risk factors and the prevalence of heart disease. And so I started my career there and continued to grow there in an administrative and a clinical capacity. And now I'm here in the role as Chief of Cardiology to help continuing that growth, not only personally, but also with our health system and for our communities.
That's wonderful. And we're thrilled to have you. So I understand you've been here about a year and a half now. And so
yes, a year and a half. Everyone has been so kind, and it's the potential is amazing. And I really enjoy working with everybody and continuing to meet more people in the community and more advocates for our patients' health.
That's fantastic. So can you tell us why medicine and specifically why cardiology?
So I've always been a science-based guy. So, growing up, I enjoyed science. And a little funny caveat, I thought I was going to be a marine biologist. And not too far from here, there's a place called Wallops Island. And we spent a week there when I was in high school. And that killed my marine biology expectations. It was a great experience from the science perspective, but it was like, I don't think I could do this. Going into the marshes and collecting insects and stuff, it was quite something. With that being said, unfortunately, I've seen firsthand the effects of heart disease on certain family members and friends. And, every time it's kind of kept me wondering, like, how did that happen? All of a sudden this person was fine, and then now they've had a heart attack or they've passed. And that really shaped not only my desire to want to be a doctor in general, but also to be a cardiologist, to understand, why these things happen, and then hopefully make an impact and say, okay, we can do something about this. And, it's really the reason why I get up every day and, see patients and do what we do.
Fantastic.
I love that.
I love that too.
Well, we're going to talk a little bit about medicine, actually probably a lot about, the doctor side, the clinical things you do, but tell us on a human level what heart health means to you, especially for your patients and the people you see.
So it's the leading cause of death in the world. And everyone that we survey, or if you ask, knows somebody that has had heart disease or passed from the same. So we know in many ways in our mind, it's kind of like, a high chance that we're going to suffer from that ourselves or our loved ones or our family members. And heart health is one of those things that is a buzzword because it's something that you kind of deal with when you have had a diagnosis of heart disease, but also something you do in a preventative manner. And I know we're going to talk a lot about that, but it's like a buzzword that just says, okay, this is something that's important and we have to do something about it, whether you already have the disease or whether, you're going to trying to prevent the disease.
So that's an interesting point because most people really don't do anything until something presents, right? And maybe, you're in your 50s or in your 60s or kind of, further along the time continuum. But why should somebody younger, like someone who's in their 30s or their 40s or even their 20s, kind of consider heart health and what needs to happen in a preventative measure?
So it's wonderful that you asked that, because what we're learning more and more is that even minimal activity is beneficial, right? And if you think about it, like for example, if you walk for 15 minutes a day, that adds up over time. It's not the 30 minutes or more, but it adds up, and we do see a significant benefit. And, basic habits that we develop when we're younger, we're likely to carry those on as we get older. So, just food choices, exercise choices, refraining from certain bad habits such as smoking and tobacco use, these go a really long way. And the way I like to tell patients is, you're kicking the can down the road, hopefully, right? So it's really important to get into those habits early. And even if you do it little by little, it does scientifically has been proven to make a difference.
Interesting.
I love that. Sometimes it's so overwhelming to get started in a new program and just get out the door and do what you can, even if it's walking the dog around the block.
Because we think, okay, look, I got to walk at a moderate pace for 30 minutes a day, or I got to, exercise intensely for at least 20 minutes a day. But life happens, right? And it makes it very difficult. So instead of getting discouraged and saying, well, I can't do that, even doing a little bit, going for a quick walk when you get home, or even at work at your lunch break, those things make a big difference.
That's encouraging. I mean, sometimes it is just the little things that make a difference.
Absolutely.
So that's really encouraging.
What are some of the biggest misconceptions about when heart disease actually begins?
So one is that you can't do anything about it. That's, I think, probably the biggest misconception. Like, my granddad, my mom, but everyone's had heart disease.
Yeah.
I can't do anything about it. I know I'm doomed. And so that's a misconception. The other thing is we've understood, there have been studies that have shown that even in infants, they start developing fatty streaks in their arteries, and other folks do not have any kind of buildup even in their 70s and 80s. And so there's a lot of gray area still when it comes to this. And the key is really identifying what your own risk is, identifying where you stand and what your risk factors are.
So speaking of risk factors, what are some of those early signs or early risk factors that someone should pay attention to?
So the traditional risk factors have been, the presence or absence of diabetes, high blood pressure, cholesterol, sleep apnea, and genetics has always played a role. And going back to our past example that, I'm doomed. Everyone in my family has heart disease. I'm doomed. We're learning a lot of that genetic predisposition is coming from cholesterol management and particles that are in the blood, some that we can do things about and some that we really can't. But there is a lot of opportunity, so to speak, to address these things. And I think the biggest trigger is if you don't feel right, if you know your body well and you don't feel right, you should get checked out. And I'm not saying it's heart disease, but it could be a variety of things. But if heart disease occurs in that workup, we can do something about it.
It's good to know.
How do everyday sort of habits, like you just mentioned, sleep? This was a conversation we've had too. It's such a big part of your heart health. All these things are connected. And instead of looking at them separately, how are you sort of treating them as holistically?
I think the best advice I could give somebody is have a great relationship with your doctor, because they are going to know you through the good times and the bad times. And having those conversations and looking at the person as a whole and an individual, because we're all different. We're all the same and we're all different. My kids love this Sesame Street book that says, we're all the same, but we're all different. And it resonates in this field because we all have different risk factors. We all have different, lifestyles and other things, but that relationship and that one-on-one conversation with the heart care team and your clinical providers, it makes the world of difference.
That's awesome. And being honest when you're having
Yeah,
a conversation.
that's always a big one.
And we always say, I'm here for you. And it's true. I am there for my patients, but in the end, they have to make those decisions, and they have every right to make whatever decision that they want to make. But our job is to provide advice and be a member of the team. It's a team approach, right? It's not like, hey, I'm telling you to do this. No, I'm a member of your team here to try to work on your health with you. So how do we do that together?
Yeah. So, earlier you talked a little bit about prevention and how important that is to kind of get ahead of what may exist in your family genetically or even just your habits that tend to exist. Now, we all know we live in a busy, busy world. Family, work, social activities. What does it realistically look like to really have preventative measures? Earlier you talked about walking, but is there something else that someone can really kind of look into to help with the preventative measures that may exist?
Absolutely. So the diet and exercise pieces are always big. The other aspect of that is risk factor management. So, even regularly going to visits, establishing a relationship with a care team, as we discussed, identifying, okay, so if I develop high blood pressure, can I get to it early on and treat it early on? If I have high cholesterol, when does that need treatment? And there's so much advancement and technology in this space that we can really find things early on and make a difference. And so I encourage our listeners and other folks, our colleagues and our patients, to do that.
Awesome. Well, I'm curious, what kind of advancements are you thinking of?
So there's wonderful things, including things that we are doing here at Bayhealth, and they involve not only simple blood tests that we get with our practitioners, which include cholesterol panels, right? With simple as that, looking at our good cholesterol, our bad cholesterol levels, but also other particles in the blood that are new, so to speak. Lipoprotein little a is one of those. And there's a lot of buzz behind that. The interesting thing about that is we can't directly treat it and it's genetic, but there are things we can do to indirectly lower the value some using certain other therapies. And then there's direct treatment options coming for that as well. There's also the ability to actually look inside the heart arteries and see if that process has started using something called a cardiac CTA or coronary calcium scores. They have their separate roles, similar but separate roles in the diagnosis of heart disease. And with that, the use of AI in imaging. And so echocardiograms, which are ultrasounds of the heart, and other modalities that really are giving us giving us eyes where we can't see, so to speak, and helping us make diagnose diseases quicker and giving folks the option to treat them quicker and getting to them quicker.
Yeah, that diagnosis early is always really important.
Absolutely.
And so even if, I know especially important if you happen to have a family history of heart disease. And so if that happens to be the case, when would you recommend someone get screened?
So, it can start at the primary care level. So you want to have your primary care physician or practitioner really, follow the guidelines on cholesterol management, checking blood pressures and other things. And then based on risk factors and other assessments, specialists like cardiologists can order some of the tests that we discussed to say, hey, we should do this as kind of a further risk stratification thing. The other thing that is powerful and we don't utilize as much, but we all can do it. There's several risk calculators available by the American Heart Association, the American College of Cardiology, and other institutions that allow us to plug in numbers and identify what our risk of a cardiac event is over the next, 10 years or so.
Very good.
That's very exciting just to have these types of developments and to, have a starting place and a conversation with your clinician saying, I need more information when I do my blood work. So not just cholesterol. Can you ask them for a more full panel?
Sure. So like we talked about the lipoprotein little a, and the guidelines do suggest checking it at least once in someone's life now. Other things like common things being common, diabetes, high blood pressure, and really monitoring those things and coming up with plans to identify them early and then treat them accordingly. Sleep apnea is also a big one that's we don't think of as much, but plays a strong role in heart health, whether it be coronary artery disease or arrhythmia management or funny heart rhythms. So.
One of the things I feel like we talked about when you first started was just little things that you can do. But what about when someone's just really busy trying to balance work and life and all of the different things? Do you have any advice on?
So I'm going to say something to you, and I don't know if you've dealt with this or you've seen family
Not me.
members. If you cannot take care of yourself, you cannot take care of others around you, whether you're a caregiver, you have a family, or you have other responsibilities. So in this instance, you always have to make sure you're okay so that you can carry the world on your shoulders, so to speak. And so simple changes. So if you go to a large store, to shop for groceries or clothing or whatever, park far away, walk in, do a few laps, then start shopping. Come home from work, go for a little 10-minute walk. You have a lunch break, spend a few minutes doing that. And always, this is the best one, making the healthy food choices, right? Doesn't mean you can't enjoy what you want to eat, but, portion control. Don't eat those things, the bad things that you shouldn't be all the time. But, you can also make it a part of your life instead of being, I'm going to be very strict about it, whether it's a diet or something else. And then, you fall off the tracks and don't go back. And so really incorporating into your lifestyle is the important thing.
So if you could leave our listeners with one message, something that really sticks, something that they can really kind of hold on to, and at the end of this podcast say, you know what, I'm going to go ahead and implement that, what would that be?
I would say, and this has been said for, various campaigns when it comes to blood pressure or cholesterol, is know your numbers. And so I would say know your numbers and risk factors. So you can do that by establishing a great relationship with a practitioner, your primary care physician, a cardiologist, and really have the honest conversations with them to say, hey, this is how I feel. This is what the numbers look like. What do we do from here?
So just a quick follow-up question on the numbers. What are some of the numbers that someone needs to be paying attention to?
So blood pressure,
Yeah.
bad cholesterol, also other factors such as blood sugars and hemoglobin A1C and other things like that. So those are the numbers that you really want to know.
Is there a particular range that we need to kind of pay attention to there?
It varies, and that's where the relationship with the practitioner is so important, because a bad cholesterol or an LDL of 100 may be normal for somebody, but it may be too high for someone else, right? If they have heart disease or something else. So it's not a one size fits all strategy.
I know, when you can get your results quickly using my chart now. So someone might see those results before they have a conversation even with their clinician, and it comes back red. And is that a moment to panic or just?
No, it's a moment to be proactive. It's a moment to pick up the phone, make that appointment, or prepare for that appointment with, simple Google, ChatGPT. Learn about it a little bit. And not saying that you have to be the expert, but if you're engaged with the practitioner in the conversation, you're more likely to do something about it, right? Knowledge is power.
It's the starting point.
Exactly.
I love that you just said ChatGPT, because I know a lot of providers sometimes are kind of like anti go on ChatGPT, or kind of, what did they say, like they use WebMD as something that it's kind of like one of those things you shouldn't do. But I love that you said that, because it really does empower the patient to at least know exactly what's happening.
Because if someone tells me like my kids, if I tell them to do something, they say no. That is the standard response, no matter what it is, right? But if I explain to them why they should do something, then they'll happily do it. And it's the same thing here. We're not here to tell people what to do. We are partners in their healthcare.
You are the chief of cardiology, and we just so happen to have opened the new Heart and Vascular Institute at Bayhealth. What does that mean for patients here?
It's an exciting time.
Yeah.
We are advancing not only in providing better access of care to our patients. As you know, we have a lot of folks moving here that require care and need to establish new relationships with practitioners, but we're also advancing technology. And it's given us the opportunity to bring everyone involved in heart and vascular care together to collaborate and to provide more comprehensive, innovative, and personalized care for our patients. Whether that's the use of technology, collaboration, access, we got it all under one roof.
A lot of times people in their 30s and 40s might wait to come to a doctor to look at their numbers. What kind of things can somebody do now to proactively prevent heart disease in the future?
Know your numbers. Establish a relationship with a clinician to really evaluate some of the risk factors so that if disease manifests, such as diabetes or high blood pressure or high cholesterol, you can treat it early. Secondarily, if someone is unfortunate enough to have early onset of heart disease or buildup of blockages in their arteries, we can recognize it early and start therapies, because the therapies that we have, we can never stop the disease, right? We can slow it down. However, we can also reduce the risk of something bad happening, such as a heart attack or stroke, with the therapies and lifestyle changes that we do have.
Thanks so much for joining us. It was so nice to have this conversation, get to know you more about this program at Bayhealth and all of the exciting things coming our way.
We can't wait to see what you do. So that'd be amazing.
It's been an absolute pleasure, and I really look forward to continuing to serve the community with our wonderful team members that we have in growing the program here.
Awesome. Thanks so much for joining us for this episode of Scrub In.
Thanks for listening to Scrub In, where we bring purpose and care to every conversation.
If you enjoyed today's podcast, don't forget to subscribe, rate, and review on Apple Podcasts, Spotify, and wherever you listen.
Stay connected, stay informed, and stay inspired right here with Scrub In.